Very good afternoon. Vice Chair. So good afternoon, and we'll start with a very simple and a small presentation. Okay. Now, being homeopathic doctors, having so much of experience, you would have seen a lot of cases coming to your clinic. Okay. So out of those cases, I just want you to name few surgical cases that you keep seeing very often. Okay, very good. One of hemorrhoids, which is kidney stones, gas stones, very good. Fistula, lipomas, yes, very good. Appreciate. Hernias, cataract, fibroid uterus, fibroadenoma, very good. Good number of BPH, okay, fine, good. Thank you. And I mean, these are things that you have already named. Like for example, lot of pediatric cases we get in our clinic, whom we have successfully treated for adenoids, and we have also had successful cases treated with homeopathy when the kid was posted to surgery for tonsillectomy. So we have success cases, and of course, a few of you are shouting gallstones. Yes, homeopathy can do wonders in gallstones. Okay, uterine fibroids, and of course kidney stones, renal calculi, ovarian cysts. One of our friends was talking about BPH. Okay, that's also a possibility. And of course, you can have a lot of other things like fistula, fissure, etc., etc. See, one more area, that we can be very efficient and we can treat very effectively is hemorrhoids. Okay. So in today's session, we will try to talk about the utility of homeopathy or homeopathic approach in treating hemorrhoids. So this will be the heading, this will be the topic where I will be trying to tell you about, or I will be trying to share my experience, homeopathic approach in treating hemorrhoids, and this is me. Okay. So before going any further, seeking the blessings of Dr. Hanuman, and of course my teacher, the Einstein of homeopathy, Dr. Vijaykrishna. Now, what is it that I'll be sharing next 1.5 hours? Okay. So what are the session agendas? That becomes very important. So the first objective is, we'll be introducing you to hemorrhoids. Okay. So I'll be telling you, or I will be just introducing you to hemorrhoids, and after that, the second agenda will be, approach, homeopathic approach to hemorrhoids. Okay. So that will be our second thing, and third thing, we'll be looking at, the different remedies commonly we use in homeopathy for hemorrhoids. So we'll make a list of it, and we'll also try to give you the therapeutics of that particular thing. And as far as possible, we'll try to understand this through cases. And the last very important thing is, being a PG teacher, okay, we'll also look at the recent research exclusively happening in the field of hemorrhoids. So, comments on the latest research trials is what we'll be looking at. So these things will be our session agenda. Hope the agenda is clear. So assuming it is clear, we'll have a quick test, pre-test, at least not for you today. So we'll be looking at the introductory part, the first objective that we have planned. So what is it that we are trying to do here is, we are looking at the definition part, the prevalence, in whom exactly you see hemorrhoids being very prominent. And these things are collected from the articles that I have gone through. Like for example, the definition of hemorrhoids. So hemorrhoids are nothing but, it can also be called as piles, and it is defined as swollen veins in the anal and the rectal region. Okay? That's the definition, and if you look at the classification, we basically have two categories. One is internal hemorrhoids, and the second one is external hemorrhoids. Okay? And the prevalence, see, the articles show higher percentage of people getting affected with hemorrhoids. Okay? So few studies say the prevalence could be as small as 4.4 percentage, or it can go to as high as 36.4 percentage, the all India level. Okay, and then if you are looking at the age, again the study says it is common between 45 to 65 years of age, and it predominantly affects more of male. Not that females are not affected. If you are looking at the ratio, hemorrhoids are more common in women. So this is what the studies say. Now, quickly getting into the homeopathic part. Okay, we look at the approach, and the approach we will be seeing two cases. The approach will be seeing two cases. So what we'll do is, we'll quickly recall the homeopathic remedies from our literature for hemorrhoids. Okay. So what are all the common remedies you can think of for hemorrhoids? Aloes, very good. Aspergillus, retania, viratic acid, bryonia, peonia, Hamamelis, pulsatilla, calcareous flour, carbovages, very good. Sepia, dolichos, baryta. Yes, they are all there. So these are few remedies. So time given to me is very less. So I don't know how many I can really try to take up for today's session, but we'll try our best, and we'll try to cover maximum remedies. Okay. So what we'll do is, to make this interesting, the approach, we'll have a small group activity. So if you just look at the group activity, they are dancing. So we are not expecting you to dance. But what is expected from you here is, we'll be dividing you into groups. Okay, and each group will be given a case. So you will be discussing among your group members, and one from the group will represent and will present the case to us, and you can share your group understanding. Okay, and I will tell you what progress I had taken, what remedy came up, is what we are going to discuss. So we'll be starting with the first group activity. And this first group is called as Allen group. Okay, and at least today now, I'll just give you the case scenario. So the Allen group, we have already divided into groups. So Allen group will work on it, and you'll be telling the remedy. Okay, hope the Allen group is ready. Done. Okay, chalo. So team 1 is Dr. Allen group, and we had this lady, aged around, please make a note, aged around 55 years. She presented with painful hard stools. Okay, and she also had bleeding stools, and she had a small protrusion. So this is the complaint for which the lady had approached me. Okay, so as a homeopath, what are all the common questions you ask in this scenario? Okay, one question is, since when? Very good, absolutely right. How did it start? Do you have any modalities? Yes. When is it more? When is it less? So she presented with painful hard stools, and she also had bleeding per rectum and a small protrusion. So your questions are all very valid. So similarly I had asked a lot of questions, and I am giving you the case scenario. It's a short case. It started a week back. So this is all what happened. It started a week back. She had a small argument with her only daughter. Okay, so daughter is in Bangalore, and she is an IT professional, and daughter wanted to switch, or she wanted to change the job. Okay, but the mother told, she said, from what I have heard, the situation of IT sector is not all that great. People are struggling to get job. You please think before you take this decision. So when the mother expressed her view, the daughter reverted to her, and she said, what do you know about IT? Fine, I know all about IT, and you don't interfere in my thing, and I don't need the suggestions that you are giving. I'll do what I know better. Okay, is what daughter said. So when daughter said this, very important for a homeopath is, how did the patient feel? Okay, because our sensitivity and our reaction can vary from person to person. So this is a situation. She has given some suggestion, and the daughter has given her back. So what did the patient feel? Why did she land up with hemorrhoids? Is all very, very important. See, why she landed up with hemorrhoids is the key. She could have landed up with something else. I hope you are getting my point. So the reaction to the situation leads to the disease. So this process, or understanding this process is very, very important. So what happened? Doctor replied, yeah. So what was the patient's reaction? Sir, I know I am not from an IT professional. As a mother, elderly lady, experienced lady, she can at least consider what I am telling. And in front of me she started weeping. And the character of blood is dark and stools are very hard. So this is the case scenario, this is what happened. And I want the Alan group to analyze the case, evaluate and give the probable rubrics, justification for the choice of repertory and what are the probable remedies and how do we differentiate them is what I expect from the group. So what are your inputs?
Maybe she's feeling worthless.
Maybe she's?
Feeling worthless because
Okay.
the daughter is not.
So one of our young colleagues says maybe she is feeling worthless. Okay, that is possible. That could. Okay, so one of the other girls says, other doctor says, must be she feels bad that her opinion is not respected. Very good. Any other inputs from the group or from the audience? So feeling worthless. Okay. And if you read the case scenario again, what was coming out very evidently is at least she should consider what I am trying to tell as a mother. Okay. So where she felt bad was she felt her opinion was not taken into account. Okay. Fine. So going back to repertory, and that's why I tried to ask you the choice of the repertory. You will be getting this rubric in a repertory which has wider rubrics related to mind. So my entry point in this case, I will be showing you the repertorial chart. The entry point, the Allen group, the entry point is expects our opinion to be respected. You have a rubric. So she was very clear, this is what she wanted, at least to respect her opinion. You do what you want. As a mother, I have a right to tell what I have to tell. At least, respect it is what she was feeling. So this was the thing, and I have also taken the result. What was the result? What happened in the bargain? The stools became hard and she started bleeding and she also had a protrusion. So considering all this, the rubrics I took, mind, opinion, respected, expects our opinion to be stool hard, hemorrhage from the anus, hemorrhage which was dark and hemorrhoids which are external. Two remedies come up, Hamamelis and podophyllum. Hamamelis and podophyllum. Okay. Now, which should be prescribed? Is it more of podo or is it more of Hamamelis? Why not podophyllum? Huh? Yeah, mental state, podo is also covering. Okay. Huh? Okay, wait. Okay. So, a person who desires more of respect is Hamamelis. Hamamelis is a very, it's a very lesser known remedy, but you have to remember the pathology also. If you read Hamamelis, it affects more of veins. Fine. For these people, esteem is very important. For them, respect is very important. So keeping all that in background, we ruled out podophyllum, we gave her Hamamelis, and after Hamamelis, within next 15 days, she came for follow-up. She was much better, no bleeding, even the external, the hemorrhoid, the protrusion what was there, that also considerably reduced. Okay, so this is the first case. So moving further, what we'll do is we'll try to understand Hamamelis hemorrhoid complaints. We are running short of time, so what we'll do is we'll not discuss the entire Hamamelis drug picture. We will limit ourselves to the topic given and only the hemorrhoid part, not even the rectum part. I am trying to focus only the hemorrhoid part of Hamamelis. So from your knowledge, from your understanding, what is it that you know about the hemorrhoids of Hamamelis? What do you know? We have already got few. I mean, it's a remedy for external hemorrhoids, and it is a remedy which predominantly acts on the veins. You know, from the materia medica of Hamamelis, it acts on veins and it will cause dilatation. It's a beautiful remedy for varicose veins. The same pathophysiology happens to the rectal veins. That's what we call it as hemorrhoids. So what you see here is the principal action of this drug is on the veins, especially of the rectum, genitals, limb and throat. So you also know it's a beautiful remedy for varicose Hamamelis. Varicose vein, varicose. Okay? Limbs and throat producing venous congestion, varicose vein, hemorrhoids and hemorrhages. This is what Dr. Phatak says. Okay? So from here we'll try to understand the action of Hamamelis on hemorrhoids. Okay? So what you see here is Hamamelis has more of bluish. The hemorrhoids are congested, and if you see here, they are more of external hemorrhoids. They are painful and they are generally large. So this is what you have. And second thing, Hamamelis is usually thought of in bleeding hemorrhoid. Bleeding hemorrhoids. Okay. So what is the character of bleeding you have in Hamamelis is also very important. So it's a venous thing. So what you see is the bleed is more of passive, the bleed is more of dark, the bleed is more of black. If you read Phatak's Materia Medica, he says bleeding like tar. So that is the blackness he compares it to be. Okay. So tomorrow if you have a patient who has this bleeding like tar, you can think of Hamamelis. Stools, we saw that in our patient also. It was hard, dry, frequent and bloody. So this is what you have related to the hemorrhoids. And hemorrhoids in Hamamelis will be associated with a lot of things. So what is it? It is associated with this epistaxis. Hemorrhoids accompanied with epistaxis. The only other remedy you have in a materia medica is sepia. The only other remedy you have is sepia. Okay. And second thing, hemorrhoids associated with back pain. I mean, you will be knowing many remedies. Esculus. You also have calicar. And you also have capsicum. Hemorrhoids associated with back pain. And hemorrhoids associated with lower limb complaints. You have a rubric. Hemorrhoids associated with lower limb complaints. 4 more remedies are mentioned: Lycopodium, Nux vomica, Ruta and sulfur. So these are all the accompanying symptoms with hemorrhoids, and a very interesting rubric you have in Hamamelis. Now what is that is, recently we had a lady, please concentrate, understand this, recently we had a lady with menorrhagia. Okay. But what was very highlighting in this case was, she was feeling very drained, very weak. At the same time, the patient herself, she was trying to tell, sir, the amount of bleeding I have is not that much. You getting it? The amount of bleeding I have is not that much, but I am feeling very drained. If you see me, it's like almost I have had some 6-7 pads of flow, but hardly 1 pad. But that itself is draining me a lot, sir. I am feeling very weak. Was the statement given? I have not given a Hamamelis. Remedy was something different. But how do you convert this situation into a rubric is very important. How do you convert this into a rubric? Where do you check? Which section of the repertoire you check is also a very important learning point. So one of the doctors says female. Okay. One of the doctor is opening her mobile and trying to search. So where do you see? So generalities. So under generalities, what will be the sub-rubrics? Okay? Okay, very good. One doctor is coming very close. So the rubric here is weakness disproportionate to loss of blood. Only 3 remedies we have in our materia medica. One is alumina, the second one is ipecac, and the third one is Hamamelis. And that lady received ipecac. She had bright red bleeding. Okay, you know Hamamelis has more of dark bleeding. Okay, she was given ipecac and she beautifully improved. So the idea here is how do we convert into a rubric is also very, very important. So the second case, I will come back to this a little later. We'll quickly look at the third case. Okay. So third case is a case which is given to the team 3, the Clark team. So here we had a homeopath, who had called me few days back, and she had bleeding per rectum. Okay. Now, how do we solve this case? Now, how do we go ahead? How do we solve it is very important. Again, what questions? What are the questions? Huh? Since when? What happened? Why did she land up with bleeding? Okay, these are the questions that should run through in your mind. So I'll give you the case. What could be the probable question? Since when? What was the cause? What was the character of blood? See, the situation is very simple. I'll just narrate the situation. She had some problem with her laptop, and it was not working. And she also had an assignment. She had to, there was a deadline, but tomorrow evening she had to present the assignment. So unfortunately, laptop was not working. So she requested her husband, boss, this is not working, please get it fixed. So husband tried in the local area and they said, sir, we can't fix this, you will have to go to a higher center. So when he came back and told, she said, no, I require it now, please get it done. So that man was very rude. Okay, so now you expect me to go that far, get it done. If this is not done now, what will happen? Are you that big that I'll have to do all this for you, blah, blah, blah. Some small argument happened. For us, the argument is not important. What is important for us? What did the lady feel? What did the patient feel? That becomes very important. So I'll keep it very simple. The lady felt very bad, very insulted. So this is not what I expected from me. More of disappointment. More than disappointment, what she said was, she felt very bad, she felt insulted. Okay, right? So, straight away given you the rubric, but yeah, this is the story, we'll skip the story. Next day, she had a very hard stool followed by bleeding. See the reaction, mind and body. Okay. Next day, she had a hard stool and she developed a small protrusion. She felt next 3 days she might be better. She was managing with diet. Unfortunately, it did not help. She continued to have hard stools, she continued to have bleeding and of course the protrusion. That's when she called me and we prescribed a remedy. She was 30% better within next 24 hours and next 3-4 days she is absolutely fine. Okay. Now what I want from you is discuss among the group, analyze the case and suggest the appropriate remedy. So what could be the probable rubrics that you can think of? Okay, ailments from being insulted. Okay, it's a direct rubric. So in your repertory it is given as ailments offended from. Okay, you don't have direct, at least few repertories, you don't have a direct rubric, symptom that you add to this. Because that has some 18-19 remedies. You have to cut it short. So what is the other thing that you add here? Please read the case again properly and there is something very interesting coming up. Huh? So your attention here, hard stool followed by bleeding. So last 3 days she has been having hard stools and then she has been bleeding. So that is a pattern that you observe in this lady. Okay? So what becomes important, going back to the repertory, is you get 2 very important rubrics. Ailments from offended being. See the second beautiful rubric taken. Hemorrhoids from anus after a hard stool. You have erect rubric. Hemorrhoids from anus after a hard stool. Every time she passes a hard stool, followed by hemorrhage. So when you club this, this is the remedy that comes up, and the remedy prescribed was Natrum. Okay. So Natrum 1 ml, 1 dose was given, and the follow-up I already gave you, and she beautifully improved with Natrum. So a small material of Natrum related to the hemorrhoids. So the remedy, as you all know, is prepared from the common salt. And what is the character of stool that you have in Natrum? Crumbling. So before crumbling, you should add the word dry. Okay. It crumbles because of dryness. Fine. So it's a miratic element that you see, that there is stools which are very difficult, very dry, crumbling, and stools which are blackish. Stools which are blackish. And coming to the hemorrhoids, hemorrhoids which are painful and hemorrhoids which come up during pregnancy. Bleeding from anus after or from a heart stone. Okay, bleeding from anus after a heart stone is what you have in Natrum. Okay. So one last case and then we will stop. Okay, we'll take up this last case and we'll continue in the next class. So this is again a small and an interesting case recently seen in clinic. 30-year-old man who is working as a senior consultant in a private firm, he again developed a small swelling and he had a bleeding per rectum. Bad pain, bleeding per rectum. He has RMO in the private firm. So he took some medicines, and that surgeon told, if you are not better with medicines, then we may have to plan a surgical intervention, is what he had told. So 3 days he took the medicines and he was not better, and he came back. See, these are all acute cases that I am trying to narrate. So acute cases, as per animal, it will have its own acute totality. Now what is the important thing in the acute totality? You ask for cause. Yeah, you ask for the cause and you make up a small central totality. Okay. So what we did was, we asked him what happened. See, 2 days before he started, he had a party, and he occasionally drinks alcohol, but that day the alcohol content increased, fine, and a lot of food also he had with alcohol, spicy food, etc., followed by swelling, pain, and difficulty in passing stool. Okay. He had to visit toilet often, and many times it is not all that satisfactory. He has to go, though he is having that pain, he is forced to go, but he is not able to pass. So the agenda for your group is mention the approach to the case, mention the appropriate rubrics, discuss the possible remedies. Approach, I already told you. What is the approach? It's an acute thing. So you take up you come up with an acute totality. And what could be the probable rubrics? Ailments? Yeah, ailments after alcohol, very good, possible. Ailments after spicy food, possible. Simple case, simple remedy. I know you know the remedy. Yeah, remedy is very clear. But going through the rubrics, see, there is a rubric under the chapter hemorrhoids. Sir, under the chapter rectum. Hemorrhoids after abuse of alcohol in sedentary people. That's one thing I taken. Constipation, ineffectual urging and staining, hemorrhoids, painful. And if you take this and you repertorize, the remedy that comes up is vomica. Remedy that comes up is vomica. So before we close, we will quickly look at the drug picture, or the picture, not drug picture, the picture related to hemorrhoids and vomica. Okay. So this is the father of all piles remedies. One of the most commonly used and abused remedy for hemorrhoids. Okay. So what is that indications or what is that symptoms related to hemorrhoids that comes to your mind when we talk of Natrum? Okay, they are hypersensitive. What is hypersensitive? All senses. Okay, but related to hemorrhoids, her point is they can be very sensitive to pain. They cannot bear pain. So that is a possibility. But what brings on hemorrhoids in Natrum? Okay, sedentary habit. Okay, ineffectual allergy is a PQRS in Natrum. Ailments, sedentary habits, what else? Alcohol, yes. Stimulants. Okay, spicy things, fine. So what you see is the main cause for hemorrhoids in Natrum is alcohol, sedentary habits, spicy. Okay, and you also have, I can share many cases where people after taking allopathic remedies, antibiotics, they come to us with hemorrhoids. They come to us with bleeding piles. Nux does wonders. So remember Nux vomica, bad effects of allopathic drugs, and of course bad effects of purgatives. Hemorrhoids after purgatives, Nux vomica. You also have another remedy, I will be sharing it a little later. But as of now, bad effects of ailments from purgative, you can also think of Nux vomica. So moving further, these are the ailments. Now we are looking at the hemorrhoids. What is the type of hemorrhoids? Is it internal? Is it external? Is it bleeding? That is what we are trying to look at here. So hemorrhoids in Nux vomica generally they are large. Okay? Hemorrhoids are internal hemorrhoids. Hemorrhoids are painful. Hemorrhoids are chronic, and hemorrhoids can be touch aggravates, and hemorrhoids better by warmth. See, this is a situation many times we have patients telling us, sir, sitz bath. If I sit in sitz bath, I feel better. Okay. 3 minimum remedies should come to your mind. One is arsenic amal. Sulfur is better by cold. Okay, it can be muriatic acid. See, muriatic acid better by warmth externally. Okay, some warm application they might feel better. Arsenic, retania, muriatic acid, and of course you also have Nux vomica, better by warmth. Okay, so you can also think of Nux vomica in the complications of hernia. In the complications of hemorrhoids, strangulation or strangulated hemorrhoids, and as one of the doctor was trying to tell us, this is a PQRS, or for me in my clinical experience, if they have no urge, I don't give Nux vomica. If they have no urge, then we have remedies like bryonia and opium. Absolutely no urge. But in Nux vomica, they have frequent urge. No urge, then it can't be Nux vomica. So this is the take-home message. And this ineffectual urging for stools in Nux vomica, it comes from irregular peristaltic movement. Okay? So this is about Nux vomica. So what we studied is, we spoke of Hamamelis, we also spoke of Natrum, and we also spoke of Nux vomica. So in the continuation, what we will do is we will talk of Asculus and all the remedies that you have told. We will try to take up all those remedies in detail. Okay, so thank you.